Good morning, guys. Today we're going to talk about ADHD and dopamine reuptake inhibitors, which works very differently than Adderall, which is an actual release of the dopamine, increase of the release of dopamine. All right, so let's go. ADHD is strongly associated with differences in how the brain regulates dopamine, a neurotransmitter involved in attention, motivation, reward, and executive function. One important mechanism in dopamine reuptake is that first normal dopamine signaling. A neuron releases dopamine into the synapse. The dopamine binds into the receptor on the next neuron, transmitting a signal. Then the dopamine transporter removes dopamine from the synapse by transporting it back into the releasing neuron. This is called dopamine reuptake. And this works the same way as, let's say, depression medication, SSRI, NRI, reuptake, blocks the serotonin as well as neuroepinephrine. So what happens in ADHD? Research suggests that some people with ADHD alter dopamine signaling. In some brain regions, dopamine may be cleared for the synapse more quickly, or dopamine release may be less effective, resulting in the weaker signaling. The exact pattern varies between individuals, and ADHD is not caused by a single dopamine abnormality. However, it reduces dopamine signaling through contribution to difficulty sustaining attention, impulsivity, reduced motivation for tasks with delayed rewards, and challenges with working memory and executive function, which is typically the more disadvantaged area, or something that I wouldn't say disadvantaged, something that you need to work on for ADHD. Now, how stimulant medication help? Medication such as methylphenidate, like I'm on, it is a block the dopamine transporter, DAT, and this is what I'm talking about, the dopamine reuptake inhibitor. It allows this dopamine reuptake, allow dopamine to remain in the synapse longer and increasing the signaling. Compared to amphetamine-based medication, sometimes it also inhibits reuptake, but additionally increases the dopamine release from the neurons, which I think that's what I need. So the brain neuron involved, we talked about this before, prefrontal cortex, striatum, and anterior cingulate cortex, as well as frontal striatal circuits. Now, something else more interesting is a simple analogy of it is that the release is sending the email. The receptor is reading the actual email, and the reuptake is archiving the email so it retains in your synapse longer. Medications such as methylphenidate, dextroamphetamine, which is the Adderall, as well as bupropion, which some people find helpful, but it's not normally used as an ADHD medication, but it can help. Medication that works differently are amphetamine, dextroamphetamine, listroamphetamine, methamphetamine also. And methamphetamine actually is getting a little more attention combined, like I talked about the previous episode, combined with the reuptake inhibitors, because it releases the dopamine more instead of blocking the reuptake inhibitor, and that's what Adderall does. So if the doctors might want to be able to combine both types of medication and see which one works better, trying to wean off one or and all that stuff. So it's worth that ADHD involves more than dopamine alone. Other transmitters, particularly norepinephrine, also plays a major role, and genetics, brain development, environmental factors all contribute to the condition, which I don't agree, but in a way, I believe that ADHD you're born with is in your genes. People can develop ADHD at a young age, but to say you have ADHD when you're older, and suddenly have adult ADHD, I personally don't believe it unless you do a DSM-5 test with an actual licensed psychologist and get the report. Send it to me and I'll let you know. Because, usually adult ADHD people, they already had diagnosis when they're kids, and they are able to actually move on and to CBT therapy or CBT therapy, cognitive behavioral therapy, a lot more than just medication when the medication is stable. That's just like I am, and I'm seeking CBT therapy all the time, and trying to actually improve yourself and make that what the Western world has said that ADHD is a disadvantage or disability, make that into your superpower. So there we go. Take care and good morning.